Okay, quickly I'm going to talk about fractures as we talk about immobility in the pediatric patient. Commonly, if a child has a cast on, it will be placed and they will be discharged home. Depending on the type of injury that required the casting, they may stay as an inpatient for a day or two. But let's talk a little bit about this. And this should be review as you've had this information already in your other agency classes. So, by the way, this first picture here, this is what's known as a spica cast or a body cast. It comes up over the pelvis, and it typically is used for either femur fractures or hip dysplasia, or a fracture of the pelvis where they need to stabilize it. You'll see the bars that are between the legs. Those are called stabilizing bars. And it just lends some extra support to the legs of the cast. They are not to be used to help with lifting or moving the patient. They are not that strong. We have a long arm cast. Rules for casting for fractures or injuries is you need to immobilize the joint above and below. So most likely he has what's called a buccal fracture, where it's an even crack right across his forearm, his radius or his ulna. And because it is a fracture, they needed to immobilize his elbow and his wrist. So that is why he has a long arm cast. Now that they will leave that in place for 2 to 3 weeks, long enough for the bone to begin to mend. Once it has solidly started mending, then they will put that in a short arm cast, where he will then have freedom, range of movement of his elbow. So sometimes casting isn't the only solution for fractures or injuries to the child. So there's 2 types of traction. There's what's called a skeletal traction or a skin traction. When skeletal traction is used, that's when a pin or a wire is placed into the bone above or below the injury to the bone, and then counterweights are applied to help the bone align. They may also go in and put several bone fragments back in place, and they will use pins to hold these in place, and then the counter traction is also used to allow them to begin to heal in that position rather than being pulled out of place by contracting muscles. Now they have come a long ways with traction and pinning. They now have what are called orthopedic fixation devices, and this is where they'll put a pin in above and below, and then they'll do a bar, an exterior bar, and they may still cast, but what this does is it keeps that tension above and below the injured area the same as what a counterweight would do in traction. And then it does allow for mobility of the patient. So you may see this on some femur fractures, tibial, fibular fractures, and you're starting to see this on some cervical fractures. So the purposes of traction, whether it's internal counterweights, is to relieve fatigue in the muscles. It helps to position the distal and proximal bone ends. It immobilizes that fracture site, prevents deformity, and it helps to reduce muscle spasms. The thing about when you have enough force or trauma to crack a bone, it also injures the surrounding muscle tissue. And when that bone breaks and the muscles are injured, it causes spasms. And they spasm to try to hold the bone in place. But if that bone is offset, the body can sense it's not right, and it will continue to spasm to try to place the bone in the right spot. By using traction, or reduction is what they call it, where they go in and they position the bones, so they put them in the right place, you will still have some muscle spasms, but they will start alleviating as the body recognizes it's aligned and it begins to heal. So this is just a diagram to show you what counter traction and traction would do. So counter traction is when you are pulling backwards from the site, and traction is if you're pushing forwards or pulling forward. So if you imagine this looks like a dog bone, but we'll call this your femur bone. And we have counter traction, which is going to pull the top of the femur bone towards your hip, and we have traction, which is going to pull the lower section towards your knee. So if we have a patient who's in box traction, we're utilizing the upper body weight of the patient to provide the counter traction, and then we use ACE wrap and tapes on the lower extremity, and then weights actually tied to ropes to provide the traction, which pulls the lower section or the distal section of the bone away. And this helps to align the bones so then they can heal. Now, if we've got them lined up, and then all of a sudden you come in and you lift all of the weights up and take the tension off of the ropes, those muscles that I talked about that spasm to try to hold it in place, they will spasm again and it potentially unalign those bones. So you want to be very careful of the traction weights. So types of tractions. Upper extremity traction is not very common in children. You may see Bryant, Buck, Russell, cervical or Gardner-Wills tongs in pediatrics. Buck and Russell are exterior skin type tractions. I do have some photos. Just bear with me as I look at them here. All right. This is images. So here's Russell's traction. And with this, we are creating the counterweight is the body. Okay, so counter traction. And then we have the Russell's traction. See the ACE wrap. It's not casted, but it is an ACE wrap, and it is weighted, and it is pulling the distal section of the bone forward. In this instance, part of this positioning, if you look, you'll see that the leg is in a sling and it is providing some of the counterweight to that lower leg as well. Bucks is also what's called a skin traction. Neither of these have pins. Bucks is also a skin traction. We do not have that counterweight from the thigh, but we do have weights to it. You may also see patients who've broken their hip in Bucks traction. Okay, this is Bryant's, and this is for hip dislocation. Skull tongs and turning frame. This is somebody who has a cervical injury, and they, if they're going to turn them to a prone position, they will strap them in with Velcro wraps and rotate the bed, and the tongs will maintain the stability of their head and neck. Okay, and this is an image of balance suspension. Okay, now just a nice little checklist. It tells you what you need to assess for if your patient has skeletal or skin traction. I would say take a moment and review it. Big thing if you have skeletal is remember that there are foreign bodies inserted into the patient, so you need to remember to assess the insertion site, the pins and wire sites. Are they dry? Are they draining? Are they crusty? Are they red? Increased pain. You want to look for skin breakdown, all that kind of stuff. So just kind of read over this. You can pause the video and look at it if you wish. Alright, and now I'm going to go back to the slide and enlarge it. Okay, so again, this just goes over the different types of tractions. And this is what's called a halo. Remember I talked about those external fixator? This has allowed a lot more freedom. I know she's giving you an evil look, but this has provided a lot more freedom for the child to get up and move around, but it still stabilizes her cervical area. And that is all I have for that. Just remember a little bit of teaching. With any cast, it is very itchy. What kind of education would you want to provide to someone who's going home with a cast? They can take Benadryl. Distraction will help with itching. They can put ice on the exterior of the cast, and that may help. They absolutely cannot insert anything into the cast. And they don't want to sprinkle powder down into the cast, as powder is an absorbent. It will absorb moisture from the body and then grow bacteria, and you don't want to get a skin infection. You also want to prepare the family that when the cast does come off, the extremity that is affected is going to look very different. It's going to look weak. It's going to feel weak. It's going to look withered. The skin is going to look very flaky and dry, and it may be itchy. They want to bathe it gently and just very gently wipe it. They don't want to scratch at it or scrub it. Just give it some time and it will come back to normal quickly. And that is all I'm going to say about traction. Thank you.